My name is Mohamed Hany. I'm a professor of family medicine in the College of Medicine and Medical Sciences at the Arabian Gulf University in Bahrain. Today, I will start my first lecture of OSCE series, which will take you through some aspects of OSCE exam related to introduction of OSCE, how to write OSCE item, what's the importance of assessor and role player training, how to set and organize an OSCE exam, standard setting and how to determine the pass mark, and how to evaluate an OSCE exam. First, we need to talk a little bit about validity and reliability of assessment. And this is the traditional setting of an OSCE, where you use an open space and put some kind of partitions to design these cubicles, while some of the students are inside the cubicles being examined and others are outside the cubicles. I think that this setting will become different after the COVID-19 crisis, because medical schools and examining bodies will need to ensure the standards of safety for everybody and social distancing. So they will need to take a really good consideration of this while designing OSCE after the COVID-19 pandemic, inshallah, vanishes. So before we start discussing the validity and reliability of OSCE, we need to ask ourselves first, why do we conduct examinations? We conduct examinations simply to pass the competent and to fail the incompetent. If the exam is passing the incompetent or failing the competent, this means that this is not a valid exam. The validity means that you are testing what the exam is designed to test. The OSCE comes actually at a very good level in this pyramid of knowledge. It measures demonstration or shows how level in the Miller pyramid of knowledge. Logically, it tests the knowledge, the application of knowledge, and the demonstration of the necessary behavior, attitude, and skills in the exam. So how do we know that the assessment is working well? First, we need to know that the assessment is valid. It measures what it's designed to test. So if you look here, you will find an assessment. Every one of those is getting into the dart, but in a different place. So this is a valid but not reliable. It's not repeatable. You cannot reproduce the results of this assessment. This is a non-valid but reliable, because the scores are always or almost the same every time you try to hit the dart. This one is not reliable and not valid, because you are not hitting, you cannot reproduce the results and you are not achieving your goal. While this one represents a reliable and a valid test, if we may say, because you hit the center and you can rely on your aiming, because you aim almost in the same area and in the central area. This is the ideal test, the ideal tool of examination that really doesn't exist. And you should also consider the educational impact of the assessment, the feasibility of the assessment, the acceptability of the assessment from everybody who is involved, all the stakeholders, and also the safety of the assessment, considering the social distancing and the infection control, looking at our situation now with this pandemic. This beautiful slide by Cees van der Gluten shows you that when you are testing students in a high-stakes assessment, you need to get a really reliable test. You need to make sure that this score the student scored represents his real level. A good level of validity is accepted, and in high stakes assessment, because you are giving them a license and it's an exit exam, you do not really care about the educational impact. While in formative assessment, in training formative assessment, where students can improve, can develop, you care a lot about the educational impact. You also care about the validity, but the reliability here is not very important. We have some kind of types of validity that we need to go through. This is a very short version of the types of validity. There is a content validity, construct validity, predictive validity, and phase validity. By content validity, we mean that you get the sampling right. You've sampled the curriculum areas in a proper way. And the construct validity, you are using the appropriate tools to assess the content that you are assessing. So you are not using, for example, the OSCE to assess knowledge. For knowledge, you use MCQs. For clinical skills, you better use OSCE. This is an example of the construct validity, a very simplified one. The predictive validity is very important, and it's an area of debate how much the results of your exam predict the outcomes, the future performance of your graduates. And finally, the phase validity is how your assessment is compatible with your educational philosophy. If you are, for example, adopting an integrated curriculum, one of the philosophies or one of the educational strategies that goes for integration, your assessment should be integrated. You should use tools that shows that you are following the integration educational philosophy. This is the assessment cycle that all of us have been through. You start by writing the curriculum, then you blueprint, then you write the items, then you do the item banking, they execute the exam, define the pass mark, evaluate the exam, and use this evaluation to further improvement of the curriculum and your objectives. Each step of this in this cycle affects the validity and the reliability in some way or another of your assessment. We will go through some of them in this series as we go. So what is OSCE? OSCE is an objective, a careful specification of content is included. There is equality, while all candidates are presented with the same test, and you also can adjust the level of difficulty for each cohort of candidates. You are observing, and this is the most objective aspect of an OSCE. Assessors are observing a wide sample of integrated clinical skills like history taking, explanation, clinical examination procedures, and communication skills. So they are observing, they are not interacting. It's a structured, S is for structured. The marking scheme for each station is structured. There is a structured interaction between the examiner and the student according to the item template that's used. The role players are well trained and they give the same performance across the different rotas to different students. There is a standardized assessment among assessors. So assessors in mirror stations are using the same standards to assess students. And there is a well-structured blueprint where you can really sample your OSCE items according to this carefully designed blueprint. So you might use history, explanation, examination procedure at this axis and some kind of organ system at the other axis, but you can also use other modalities of blueprinting. We might need to go through this in another presentation. And finally, the CE part is for clinical examination. It is a test of performance of clinical skills. It is not the place to demonstrate your knowledge. It's not the place to describe history or to describe the theory. We have some varieties of OSCEs. The patient-based stations, the clinical task stations, and the written task stations. So this is how the OSCE looked used to look in the past, a traditional OSCE. There is a patient-based station, clinical task, written task, then there's a standardized patient-based test where we have patients in all the stations. There is another model which is a station couplets. You have the patient, then you have some kind of written task afterwards. And this is an example of, here you can find the room where the students get examined, and here you can find some kind of desktop where they can do some kind of entry, prescribing, requesting investigations, or whatever the station is about. And finally, you have the integral consultations where you have stations that take longer time and students can perform actually with standardized patient in all stations, and students can also have clinical tasks, of course, and some kind of written tasks. This is how it looks. You have the examiner here. The examiner is just observing. The student here has all the forms that he might use to request investigations, to prescribe, or to refer the case. Here you have the bed if you want to conduct some clinical examination. It will be specified in the item template. And there is also some modifications. Sometimes you have this station without an assessor. If you are if you are designing a station about communication skills, in some countries, in some examination centers, the patient is trained to assess the performance of the candidate in communication skills. In some centers, you have only the candidate and the standardized patient in the room, and it is video recorded, and the assessor is in another room, or he can look at the recording afterwards and evaluate your performance accordingly. This will decrease the level of anxiety of the candidates and improve their performance. This is the theory. In other exams, the candidates are staying in one room for the whole exam, and the assessor is taking the role player or the standardized patient and go from one room to the other, mimicking the normal daily practice. And also putting the candidate at ease. So these are the varieties of OSCEs. And for good validity and reliability, you have to assure the quality of three things. You need to assure the quality of cases, the written items. You need to train your pro players, and you need to get your assessors well trained. These are the subjects of our next presentations, inshallah. Until then, thank you very much for listening, and I hope that you find this information useful.